Hello friends, today we'll cover one more very important topic, that is the anatomy of the ovary as well as some features of the female external genitalia. This is Dr. Yusuf signing from Al University. These are the specific objectives which we'll try to cover in this lecture. The first one is enumerate the components of the female external genitalia. The second is mention the blood supply, innervation and lymphatic drainage of the female external genitalia. And third is describe the anatomical relations, peritoneal dispositions, lymphatic drainage, lymphatics, as well as the blood supply, as well as the innervation of the ovary. So these are the specific objectives which we'll try to cover in this lecture. To begin with, the female external genitalia, which is visible from outside, that is also called as the vulva. This is the picture depicting the same. And we'll try to identify the important structures. We'll not go into details, just the important structures which can be seen from outside. The first thick paddy layer here, this filled with huge quantity of fat. This is called as the mons pubis. This is the mons pubis, which is filled with a huge quantity of fat. Then deep inside, if you go inside, then there are two structures which are deficient of fat. That is, one is called as the externally, we have the labia majora, and inside we have one more thin membranous structure. These are two thin membranous structures. One is the labia majora, and the deep inside we have the labia minora. Labia minora as well as the labia majora are two membranous structures which are deficient of fat. Okay. Then we have in the front, on the top, or more proximal or anteriorly, we can say, that is there is a very important structures which is called as the clitoris. Okay, so this is just the remnant of what we can say as the penis in case of the male. So this clitoris will be well developed in case of the male and which form the penis, but in the case of the females it is not developed, and this is called as the clitoris, and this is a very sensitive structure which has a lot of nerve endings. Okay, so this is called as the clitoris. Then we have the vestibule of the vagina. Vestibule means opening. There are two openings here. One is called as the vestibule of the vagina, which is a larger opening, which is posterior, and in the front, on the more anteriorly, there is a smaller opening. This is called as the vestibule of the urethra, or it is also called as the urethral orifice. So there is a vestibule of the urethra, and this is the vestibule of the vagina. There are also the bulbar glands which will be opening, which will be called as the vestibular bulbs, which will be on either side, and there will be greater vestibular glands which will be deep inside here. So these are some of the important structures which you can see from outside. Okay, so one is the mons pubis, then clitoris most anteriorly, and then we have the labia majora outside, and deep inside we have the labia minora, thin membrane structures, and then we have the vestibule of the vagina and the vestibule of the urethra, or it is also called as the urethral orifice, and behind posteriorly we have the anus. Coming to the blood supply, the blood supply is mainly by the external as well as the internal pudendal arteries. The external and internal pudendal arteries, and the venous drainage is by similar veins called as the external and internal pudendal veins. And lymphatic drainage is into the superficial group of inguinal lymph nodes. So this, because it is externally present, so if there is any kind of infection, then you have to trace it into the inguinal lymph node, that is the superficial group of inguinal lymph nodes, not the deep one, superficial group of inguinal lymph nodes. Then the nerve supply to this region is by three important nerves. One is called as the ilioinguinal nerve, then the genitofemoral nerve, as well as the partly the postcutaneous nerve of thigh, which will be supplying mainly the medial part of the thigh as well as a part of the even the external genitalia. So there are three nerves: ilioinguinal nerve, genitofemoral nerve as well as the posterior cutaneous nerve of thigh. These are the three nerves which will be supplying the external genitalia in case of the female. Now going to the next important structure, that is the ovary. Before we go, we'll just briefly introduce what exactly is the female reproductive system and what are the structures which are within this female reproductive system. So as the name indicates, female reproductive system are those structures which are mainly involved in the reproductive system, and the main primary organs will be a pair of ovaries. So these are the main or the primary reproductive organs, and all other are accessory organs which help in or assist in reproduction. The uterine tubes. Here is the ovary, this is the ovary, a pair of ovaries, then a pair of uterine tubes. In this picture, only on one side they have shown you so that you can identify the different structures. One is the main primary organ, female reproductive organ is the ovary, and the accessory organs are a pair of uterine tubes, then the single uterus, which is in the midline, this is the uterus, then we have the cervix, the lower part of the uterus will continue below as the cervix, and then a vagina. So these are all the structures which help in the reproduction in case of the female. The primary organs are the ovaries, just like in case of the male it will be the testis. Here in case of females, the main primary organs of reproduction will be ovaries, and all other structures will be the secondary or the accessory organs in case of the female reproductive system. That is a pair of uterine tubes, the uterus, the cervix, as well as the vagina. So here you can see this is the ovary, these are the fallopian tubes. So there will be a pair of ovaries, a pair of uterine tubes, but all other structures will be in single. The uterus, the lower part of the uterus, that is called as the cervix, and the vagina. These are single. Going to the main primary organ in case of the female reproductive system, that is the ovaries. So as I said, the ovaries are the primary organs of female reproductive system, and they are in pair, and they are homologous with that of the testis in case of male. So in case of male, the main primary organ of reproduction will be the testis. In case of the female, it will be the ovaries, and these are pelvic organs. Okay, so if you can see here, this is the picture showing all the pelvic organs. Here you can see here. So here this is the pubic symphysis, and this is the pubis, and this is the whole pelvis here. So here you can see this is the urinary bladder which is present in the pelvis. Then the second is the uterus as well as the cervix and vagina, and behind we have the rectum and the anal canal. Apart from that, we also have here the fallopian tubes and the ovary. So ovary is one of the organ which is present in case of the pelvis. So it is a pelvic organ. The situation of this pelvis is in a defined fossa, which is called as the ovarian fossa. So this ovary will be present in a small depressive part which is called as the ovarian fossa within the pelvis. And anteriorly and posteriorly we have important structures with which you can easily try to identify the ovary. So in the front, so this is the picture seen from the lateral view, and you can see here this is the ovary. In the front we have a very important structure which is called as the obliterated umbilical artery. This is the umbilical artery which has been obliterated after birth. In case of the fetus it will be functional, but after birth this becomes obliterated, and this is the obliterated umbilical artery. Okay, so this will be anteriorly placed. Then posteriorly we have two important structures. One is the ureter, which is opening into the bladder, and the second important structure is the internal iliac artery, which will be behind. So if you want to trace this ovary, go in front of the ureters as well as the internal iliac artery, or trace it behind the obliterated umbilical artery. So this is how you can trace this structure, that is the ovary. So what is the shape and size of this ovary? So if you see here, the ovary is almost almond shape. Okay, almost a egg-shaped structure or almond shape or oval shape, whatever you call it as. Okay, and the size is almost 3 centimeters in length. So if you see here, this is the ovary. So almost 3 centimeters in length. Just half of that will be the breadth. So almost 1.5 centimeters, and the thickness is half of the breadth, that is almost 0.75 centimeters to 1 centimeter. So this is the total length, breadth, and the thickness of the ovary. 3 centimeters in length into 1.5 centimeters in breadth into 0.75 to 1 centimeters in thickness. The position and the looks, how exactly it look like. So in case of the nulliparous are those ladies who never became pregnant, who are young teenage girls, who are still in the initial stage of reproduction. So those ladies who were never pregnant before, they are called as the nullipara. And in those kind of females, these ovaries will be almost vertical, even though it is slightly oblique. So it is almost vertical, and the surface will be smooth. And the color will be almost grayish pink in color. But in case of the multipara, those females who were pregnant before and who gave birth to live children, or who were pregnant for many times, those are called as multipara. So in those kind of females, because of the pregnancy and stretching of the ligament, there is a ligament called as ligament of ovary. As the uterus as the fetus develops within the uterus expands to a large extent. There will be hypertrophy of the uterus, and that leads to even the stretching of the ligament of ovary, and it pulls the ovary itself. So if you see the because of the frequent and prolonged stretching of the and pulling of the ligament of the ovary, it becomes almost horizontal in shape in case of multipara. As well as if you see the surface, it will be puckered. Why it is puckered? Or uneven surface. Puckered means uneven surface. If you can see here, this is the surface. In case of the nullipara, it will be smooth and soft, but in case of the multipara, it will be puckered. This is because of the regular release of the oocyte. If you know, the ovaries will be releasing the oocytes, and these oocytes will be released from the Graafian follicle, which ruptures on the surface. And whenever it ruptures, it leaves a what you can say, a scar like thing, and which will lead to uneven surface. That's why the surface will be uneven or puckered, and the color will be almost grayish because of the frequent release of oocytes and a lot of pregnancies and other things. It almost becomes almost grayish in color. So this is the position and look of the ovary in case of the nullipara as well as the multipara. If you see the external features, there are two poles, two borders, as well as two surfaces. So what are the two poles? We can see here again, going back to this picture. So it will be the upper pole as well as the lower pole, upper pole and lower pole. But when it becomes multipara, at that time it becomes, I said, horizontal. Then how can you identify the upper and lower pole? So it is better to call it as the tubal pole, where the fallopian tubes or the uterine tubes are present. That end will be called as the tubal end. The other end will be called as the uterine, because it is toward the uterus. Okay, that will be much more better. Here also we can say this is the tubal end and this is the uterine end. So these are the two poles of the ovary. Then two surfaces. Which are the two surfaces? One is the lateral surface, which is away from the uterus, and the other which is facing the uterus, that is called as the medial surface. And there are two borders. One is called as the anterior border and the posterior border. Anterior border, which will be anteriorly placed, and this will have an mesentery like structure, a covering of the peritoneum, and by which it will be hanging, that is called as the meso-ovarinum. So it is the mesentery of the ovary. So it is having a specific name, that is called as the meso-ovarium. And the posterior border is free because it is hanging from the front. So if you can see here, this is the picture shown in from above, and if you can see here, this is the ovary and this is the peritoneum. It has two layers, anterior and posterior layer. The posterior layer covers the whole of the ovary, except the anterior border where there is meso-ovarium. So if not, it is covered on all the side by the peritoneum, and the posterior border is free. Okay, so this is how you can identify the different surfaces as well as the borders as well as the ends. Coming to the relations, so the ovary is, as I said before, it is covered completely by the peritoneum except the anterior border where we have the meso-ovarium. If not, it is totally covered by the peritoneum, and it sits in the ovarian fossa. Coming to the blood supply is by the main artery, which is called the ovarian artery. Along with that, there is also contribution from one more artery here. This is called the uterine artery. So this is the uterine artery here, which will be giving us a small quantity of also supplies a small quantity of blood to the ovary. But if not, it is mainly it is the ovarian artery, which is passing through the suspensory ligament of the ovary. Coming to the venous drainage, it is by a plexus of veins. These are called as the pampaniform plexus. Pampaniform plexus are very important clinically. So these plexus of veins which are formed around the ovary, and these are called as the pampaniform plexus, which will be draining into the ovarian vein. So the artery supplying is the ovarian artery, and the venous drainage is by the ovarian vein. So the typical feature of this ovarian vein is it is draining into different structures on the right and left side. As you know, the ovaries are so as I was telling, the pampaniform plexus which are around the ovary will be draining into ovarian vein, and from there the ovarian vein on the right side and left side will be draining on different sides. On the right side, it will be draining into the inferior vena cava, and on the left side, it will be draining into the left renal vein. There is a difference of the ovarian vein draining on the right side and left side. On the right side, it will be draining directly into the inferior vena cava, and on the left side, it will be draining to the left renal vein, and from there into the inferior vena cava. So this is the difference. Similarly, even in case of the testes, it is similar. The testicular vein will be draining on the right side into the inferior vena cava, and on the left side it will be draining into the left renal vein, and from there into the inferior vena cava. So the testicular vein as well as the ovarian vein will be draining similarly. Okay, so this is very important clinically because these pampaniform plexus of veins which will be around the ovary and the testes, and because on the left side it will be draining into the left renal vein at an angle of 90 degree. So the drainage of these veins will be little more difficult. So whenever if there is varicosity of these veins, ovarian veins, it will be the pampaniform plexus. Actually, the pressure in the ovarian veins or the testicular veins on the left side, because they are draining at right angles to the left renal vein. So the plexus will be the valves within the plexus will become what you can say as and the pressure within the pampaniform plexus increases, and there is stagnation of the venous flow and the venous blood, and that leads to varicosity of this vein, which is called as varicocele, and this is more common in case of the testis, left testis, than the right testis. This is because of the angle at which the testicular vein will be draining into the left renal vein. But on the right side, because it is opening at an angle of almost 30 to 40 degree, so into the inferior vena cava, so it doesn't affect much on the right side. So the varicosity of the scrotum which is called as varicocele will be more common on the left side than on the right side. So this is because of the angle with which the testicular vein opens. Similarly, even in case of the ovarian vein, because it is opening at an angle of 90°, so if there is varicosity of these veins and varicocele, it will be more on the left side than on the right side, but it is more common in case of male than the female. Okay, so you should know the difference on the right and left side of the drainage. Coming to the lymphatic drainage, the lymphatics of the ovary will be draining into the lateral aortic as well as the pre-aortic group of lymph nodes. Why? Because these just like the testes will be descending, similarly even the ovaries have descended from the abdomen into the pelvis. So even though they are in the pelvis, they will be draining into the lateral aortic as well as the pre-aortic group of lymph nodes. Coming to the the nerve supply, this will be by a plexus of nerves that is called as the ovarian plexus. So the blood supply is by the ovarian artery, the venous drainage is by the ovarian vein, and the nerve plexus which is supplying the ovary will be by ovarian plexus. So everything is ovarian. Okay, and this ovarian plexus is derived from the different plexuses around the renal plexus, aortic plexus, as well as the hypogastric plexus. And they all accompany around the ovarian artery, and they will be coming and supply the ovaries. It has two components as usual in case of the autonomic nervous system, sympathetic as well as the parasympathetic components. The sympathetic component will be by afferent, it will be mainly for the pain, and the efferents will be for the vasomotor, and this is from the T10 as well as T11. Okay, and the parasympathetic is mainly vasodilator, and this is from the S2, S3 and S4. T stands for thoracic as well as S stand for the sacral. Okay. Coming to the some of the features of the histology, we will not go into details, that will be studied in the histology of the ovaries. Here just a brief intro for the same. Okay, the ovaries, as you know, are lined by the peritoneum, as we have already seen. It is completely lined on all the side except near the meso-ovarian or the anterior border where there is meso-ovarian. So it is completely covered by the peritoneum, and this is modified itself into germinal epithelium, and it is made up of cuboidal epithelium. If you can see here, this is called the germinal epithelium. It is from the nothing but it is the peritoneum, and it is lined by cuboidal epithelium. And deep to it, there is a whitish connective tissue layer here, and this is called as the tunica albuginea, as the albuginea stand for the whitish layer and tunica the layer. Okay, so whitish layer is called as the tunica albuginea, which will be having very few follicles or no follicles at all. Then the next layer where there will be huge quantity of follicles will be the cortex. So this is the cortex, and deep inside is the medulla. Here in the cortex, you can see different stages of development of the ovarian follicles. You can see the primordial follicles here, then the primary follicles, then the secondary, then the mature Graafian follicles, and then they rupture, release the ovum, and then it becomes the corpus luteum. Pregnancy or lactation, then it becomes the corpus albicans, whitish body. Okay, and deep inside we can see the medulla, where it is richly supplied with the blood vessels, lot of blood vessels, as well as nerves, as well as lymphatic. Everything is filled with this area. Okay, so mainly the follicles will be in the cortex. Medulla will be having the blood supply as well as the nerves and lymphatics. Okay, so this is in brief about the histology. So you can see here again the primordial follicles, primary follicle, how they are maturing into secondary and then rupture, and mature Graafian follicle, then rupture, and all those stages. This is how the primordial follicles will be there, and these are the primary follicles, and this is the secondary follicle. So again, this is the same. Now coming to the functions. what are the functions of this ovary? The main, as you know, the main function is the production of the ova, and this begins from the stage of menarche or menarche at the age of 13 to 14 years in case of girls, and it ends by around 40 to 45 years, which is called as the menopause. And this is the menarche at which, or the menarche at which the regular cycles, menstrual cycles, will begin. And this complete duration of the reproductive life in case of female will be almost for 30 years, starting from the 13 to 14 years and ending by around 40 to 45 years. And the second, this is the main production of the ova, release of the ova, then depending on the fertilization it will be leading to pregnancy and other things. Okay, the second function of the ovaries is the production of the hormones. So this is a very important side where there will be production of the estrogen as well as the progesterone. So the estrogen will be secreted by the follicular as well as the paraluteal cells, and the progesterone will be secreted by the luteal cells. Okay, so details about that will be dealt in the histology part as well as in the physiology. Then coming to the applied aspects or clinical anatomy of this ovary, the one very important, very common is the prolapse of the ovaries. So usually, you know, the prolapse is nothing but this is the normal uterus and the vagina, and there can be prolapse of the uterus itself. So this is the uterus which is prolapsing. Okay, so it will be protruding out and it will come out through the vagina, and it will be seen from outside. Okay, so this is called as prolapse. So prolapse can be of anything. It can be of the uterus itself, along with the, sometimes there can be even the prolapse of the bladder, or sometimes, rarely, there can be even the prolapse of the ovaries, which will be protruding through the vagina. Okay, this is because of the lackness of the stability within the perineum. Okay, so if there is any weakness of the perineum, this will be leading to the prolapse of the uterus as well as the vagina, or the bladder, or sometimes even the ovaries. The second important applied aspect related to the ovaries is called as the ovarian cyst. This is also a very common thing which will be seen in case of the females, where there might be a huge accumulation. You have seen the primordial follicles, how they will be changing into primary, secondary and tertiary, or the Mechographian follicles. At particular stage, there might be, instead of further development, there might be huge accumulation of the fluid within that, and that might lead to a very large cyst, sometimes very huge cyst, which will be looking just like a pregnant lady abdomen because of the so much protruding of the cyst. Okay, so this is called as the ovarian cyst. In this picture you can see this is the ovarian cyst. So ovary with the cyst, or ovarian cyst. The third important applied aspect is the carcinomas of the ovary. So these carcinomas of the ovaries are also very common in case of the female, and in case of the teratomas, sometimes even you can see the teratomas within the ovaries. And the final last one in case of the applied aspect of the ovaries is the chocolate cyst. So in this here you can see there might be endometriosis, which might lead to severe bleeding within the uterus, and sometimes this bleeding within the uterus might be transferred into the ovary itself, and then there will be accumulation of the blood as well as the broken blood, and that leads to a chocolatey color of the ovary, that is called as the chocolate cyst. So this is seen in case of the endometriosis. So these are some of the important applied aspects related to the ovary. One is the prolapse of the ovaries, the second is ovarian cyst, carcinoma of the ovary, the teratomas, as well as the chocolate cyst. So this is all about the ovaries. If you have any doubts regarding this, you can definitely write to me and I will try to answer. So these are my references. Thank you very much. If you like my video, you can just click on the like button, and if you want to see more of my videos on anatomy, you can definitely subscribe to my channel. And if you want regular updates regarding the same, just subscribe to my channel and you'll be getting regular updates. So thank you very much.